Next we have the postoperative hypotension. So a 64-year-old man undergoes laparoscopic gastric bypass surgery, and post-operatively his blood pressure is 80/40 and his urine output is 15 ml per hour. What is the best method of improving the urine output? So here we need to know one concept, that what is the normal value of the urine output, so that whenever you encounter any value you do not get confused. So the normal value is around 0.5 to 1 ml per kg per hour. So for a 70 kg man it will be around 35 to 70 ml per hour. So as you could appreciate that this is 15, which is very much less than 35. So this is your key point. So the patient is having a less amount of normal as compared to normal urine output. So now what will be your next step? So will you be starting furosemide, trial of dobutamine, O negative blood group, insert a Swan-Ganz catheter, or give a fluid challenge and monitor the clinical response? So in this scenario, you will be giving the patient fluid challenge and monitor the response. So this patient is having a early post-operative hypotension. Now, regarding the principle in this scenario, the principle is that the early post-operative hypotension with oliguria is mostly because of hypovolemia. So you need to know this concept. Now, as we know that in hypovolemia, there is decrease in the fluid that is present in the body, and to manage that, we will start a fluid challenge. Now regarding the fluid challenge, we will assess it, that whether giving the specific amount of fluid, what is the response, what is whether the blood pressure, urine output and heart rate are improving or not. So what is the formula for the fluid challenge? It is roughly around 3 to 5 ml per kg of isotonic crystalloid solution, which is given over a period of 5 to 10 minutes. Now this is one of the formulas, 3 to 5. Now this roughly makes around 500 ml of crystalloid, which is given over a period of either 5 to 10 minutes, or roughly you could say that we can take a period of 10 to 15 minutes. Now what is the crystalloid that we can use? That is the ringer lactate, or known as the Hartmann's solution. So regarding the other options, so furosemide is in a hypovolemic patient is going to worsen the scenario, because furosemide is going to further decrease the fluid in an already decreased quantity. It will worsen the condition. Now, dobutamine, which is one of the inotrope, is reserved for those patients who have hypotension despite adequate fluid resuscitation. So the patient has hypovolemia and he is having decrease in the blood pressure, and you should be starting the patient on fluid challenge, and you can give around 3 to 4 times, and even after that the patient is having less blood pressure, then you will go with the inotropic support. So this is one of the guidelines that you will be following. Now regarding the Swan-Ganz catheter, it is used as an invasive procedure for the cardiac patients, which is not our requirement. And O negative blood group is reserved for the hemorrhagic shock. So in this case, our hypovolemic shock is non-hemorrhagic case. So this is very important, that if the patient is having hemorrhagic shock, then O negative blood group will be your best choice. So regarding the review, which you should add in your own notes, that post-operative patient with oliguria, we will label it as hypovolemia. Now, the first step is to give the patient fluid challenge, and then we will reassess, and furosemide is going to worsen the condition. Dobutamine, I have explained that it is used after fluid challenge has failed, and Swan-Ganz catheter is an invasive procedure. So in this scenario, you are needed to know two things: that what is the normal value of the urine output, how we define the oliguria, and what is the value for the fluid challenge. So these are the values which can be problematic if you do not memorize them beforehand.